Hello, Jessica Dufault here at Mindful Motion Physical Therapy. I just gave a talk this morning to the Moms Club of Madison, and it was a really great group of ladies who had some excellent questions after the talk was over. And one of those questions, which is actually a question we get a lot, was as I'm trying to work on my core strength and my pelvic health, are there certain exercises that I should be doing or even exercises I should be avoiding? And I would say there's three things to think about when trying to answer that question. So the first one is, are you in a relatively good alignment? And so knowing where your pelvis is in relation to your rib cage, in relation to your head, can really be powerful, because if the system stacks up, the muscles know how to coordinate and communicate and will automatically be a little bit stronger. So being mindful of your position is pretty important. The second thing I would say about that is the exercise that you're doing, can you still breathe with your diaphragm? Meaning, can you still feel your rib cage moving? And that's pretty important, because if our strategy is to just recruit a lot of muscle and kind of tighten everything down, that possibly is too much pressure through our deep core system. And so one of the things we look for is, can we attenuate some of that pressure and offload it with breathing correctly? And you can learn more about this deep core system, and we use a balloon model to discuss this on some of our other blogs about reflexive core, or even some of our videos. And the third thing I would say about that is we want to be really careful with something that's called doming, or kind of this bulging up of our abdominal muscles. So that if you go to do an exercise and you feel your tummy kind of puff up or your low back lift up off the ground, that would be a cue that the exercise is too challenging and that your deep core can't attenuate that force and that pressure correctly. And so I would say that's a good opportunity to back down to the next level and really fine tune that exercise before progressing. So those three things can be really helpful: alignment, breath, and watching for doming. Now, the other thing I will say about this is that, yes, the 10 minutes or 20 minutes you're spending on working your core is really important, but I would say, as a physical therapist, I'm more concerned about the other 23 hours and 15 minutes of your day. So how are you holding baby? How are you bending and lifting heavy objects from the floor? What's your strategy with your weightlifting technique? What's your posture when you're running, right? Are you holding your breath? All these things that you may be doing throughout the day-to-day activities are actually even more important than what you're doing for those 10 minutes of exercise. And again, we have lots of videos on that with body mechanics and how to appropriately align, how to breathe, how to activate your reflexive core in a way that's healthy. So hope that's helpful. Thanks.